Good afternoon, respected chairpersons and dear audience. Actually, this is not a major research work, just like a short communication. We are doing PET CT scan for the last 8 years here in Bangladesh in different centers. Even then, there are some cardiac uptake, though we are noticing. But somebody is mentioning that, somebody are not. But what is the real story behind it? Actually, I want to give some impact on that. Cardiac imaging techniques of nuclear medicine have proven extremely useful to identify subclinical diseases in the context of cancer therapy induced organ damage. I mean, there is some effect and it can be imaged on PET scan, and cardiac is one of them. PET CT scan widely used for oncology purpose worldwide, we know it, and especially for lymphoma. But tissue uptake of FDG, it depends on various factors like glucose level, fasting period, and some drugs as well. Recent data suggests that myocardial FDG uptake is not entirely due to glucose consumption. The cancer retention also found to be dependent on different enzymatic activities and endoplasmic reticulum as well. This enzyme can process many hexoses, and ultimately there should have some toxic effect on the myocardium and endocardium as well. And now it is possible to identify potential early sign of metabolic cardiac injury by assessing the changes in the cardiac FDG uptake by PET CT in patients with lymphoma before treatment starting, during, and after the treatment. There are certain cardiotoxic drugs. Here is a good combination of nuclear medicine physician, radiologist, and oncologist. So I think there are different regimes of the chemotherapeutic tracers, but for lymphomas group, having definite effect on cardiac endocardium, and as well as myocardium. So chemotherapy and radiotherapy induced cardiotoxicity encompasses various forms of injury to the cardiovascular system that trigger an increased production of the reactive oxygen and nitrogen species, lipid peroxidase, and inflammation. That leads to cardiomyocyte apoptosis and interstitial fibrosis, and increasing the risk of impaired coronary endothelial function, left ventricular dysfunction, and ultimately heart failure. So we should notice that. And this study was aimed to identify the potential early sign of metabolic myocardial injury by assessing the changes in cardiac FDG uptake by PET CT scan in patients with lymphoma before and after treatment. As I mentioned, for oncology purpose, mainly PET CT we are using, but for cardiac disease diagnosis, and especially here, I am just presenting the cardiac uptake for evaluating the cardiac toxicity. Here nicely showing that the baseline scan. Here you can see the cardiac uptake only 5.8, and the interim period it is 8.9, and gradually increasing after post-therapy scan. You can see it 9.6. So definitely predicting the uptake in the myocardium. Here I enrolled 50 lymphoma patients, and that were analyzed in our center. And PET CT scan was conducted following the standard protocol. Left ventricular myocardial maximum uptake, measured in SUV max, or measured at baseline, before chemotherapy and 6 weeks after completion of the therapy. In addition, body weight, fasting blood sugar, post-injection time, and the injected dose of FDG between the scans were recorded properly. PET CT scan now, the state-of-art nuclear medicine procedure, all of you know that. It can change the management, it can change the diagnosis as well. So it is now well established. These patients were just instructed for fasting for 6 hours. This is the standard protocol. And there was no limitation of the medications during the scan or before the scan. On the day of a scan, body weight, fasting sugar, and IV puncture for injection of the FDG, and blood sugar should be less than 180 milligram per DL. FDG PET, the dose, it depends on the machine. Here in Dhaka Medical College, we are using Philips machine, having a very low injection, low FDG injection. 3.5 to 5.5 milligram is enough for good image. But in other machines like GE or Siemens, they are using probably double. So there should have some technological advancement in Philips machine, I believe. The acquisition parameters of CT scan included 5 millimeter. Here is the protocol. I no need to talk about this. The mean age of my study patients, 50 patients, like 45 years, and 45% are female, and 15 patients had hypertension, and 60 patients had non-Hodgkin lymphoma, and only 40% had Hodgkin lymphoma. Only 5 patients took adjuvant radiotherapy. It is very important during interim response. If chemotherapy is not responding well, then sometimes oncologists choosing the radiotherapy as well. And all regimes of the drugs included cardiotoxic drugs. We observed that only 60% patient, 60% patient showed the uptake in the myocardium. Others not. The mean SUV max was 3.5 plus minus 2. And after 6 weeks of completion of therapy, it was 6.5 plus minus 0.4. And the difference was significant. You can see here, p-value was 0.001, less than 0.001, and the data was analyzed in this software. Here is the cute example of my study patient. You can see here the case of Hodgkin lymphoma. This is the aggressive form of lymphoma. Here you can see the lymph nodes in the cervical groove and the axillary groove as well in the mediastinal groove. But in the baseline scan, there was no cardiac uptake. And here, after 6 weeks of completion of therapy, here you can see good uptake of the FDG in the myocardium, but other lymphatic, I think complete morphologic and metabolic regression of the lymph nodes. So clearly depicting the myocardial uptake here, you can see, you must believe there's some toxicity. And one patient, just I wanted to show here that the uptake is here in a case of a non-Hodgkin lymphoma patient, but after subsequent follow-up, you can see here there was no uptake. So on echocardiography also, there was no wall motion abnormality, and this patient had no cardiac abnormality in the CT angiogram or other findings. Chemotherapy in patients with lymphoma caused an unbalance in cardiac metabolism, evidenced by higher myocardial uptake, and antineoplastic therapies improves definitely survival. However, there is some toxic effect on the other cells. So how we can assess these things? Now the echo is very advanced, so there is some change in the strain in the echocardiogram, and ultimately there should have some evidence of the failure, the low ejection fraction, ultimately cardiac failure. So doxorubicin, one of the important drug, you can see this study highlighted a dose-dependent action of the drug on the myocardium, and the ejection fraction also getting lower in case of cardiotoxic drugs. Here you can see as the SUV max increasing, the echocardiogram showing the low ejection fraction. So what do you think in other cases? There are different study, like ovarian cancer. There is no uptick in the myocardium in the baseline scan after chemotherapy. So here you can see one ovarian cancer patient, remarkable and morphologic regression of the tumor, but there is no uptick in the myocardium. So lymphoma particularly having this kind of phenomena. Ladies and gentlemen, in conclusion, my study showed a clear spectrum of increasing myocardial FDG uptake in patients with lymphoma before and after chemotherapy, and different literature review results also comparable with these findings and suggest that FDG PET CT scan is a sensitive and reliable imaging exam to detect early metabolic sign of cardiotoxicity. And we always recommend for further evaluation, preferably with ECG and echocardiography and clinical correlation to avoid major cardiac events. Okay, Thank you so much for your kind attention. Thank you.